ਕੀ ਤੁਸੀਂ ਕਿਸੇ ਵੀ ਕਿਸਮ ਦੀ ਦਰਦ ਤੋਂ ਪਰੇਸ਼ਾਨ ਰਹਿੰਦੇ ਹੋ? ਹੁਣ ਫਿਕਰ ਦੀ ਲੋੜ ਨਹੀਂ, ਕਿਉਂਕਿ ਸਿਰਫ 90 ਸਕਿੰਟਾਂ ਵਿੱਚ ਤੁਸੀਂ ਦਰਦ ਤੋਂ ਰਾਹਤ ਪਾ ਸਕਦੇ ਹੋ। ਮਾਰਕਸ ਫਾਰਮੇਸੀ ਦੇ ਐਲਨ ਗਲਾਸਰ, ਜੋ CKNW ਤੇ ਸ਼ਨੀਵਾਰ 6 ਵਜੇ ਸਿਹਤ ਸੰਬੰਧੀ ਪ੍ਰੋਗਰਾਮ ਕਰਦੇ ਹਨ, ਨੂੰ ਆ ਕੇ ਮਿਲੋ ਤੇ ਆਪ ਪੁੱਛੋ ਕਿਵੇਂ ਦਰਦ ਖਤਮ ਹੋ ਸਕਦੀ ਹੈ। ਇਸ ਐਡ ਦਾ ਹਵਾਲਾ ਦਿਓ ਤੇ ਮੁਫਤ ਕੰਸਲਟੇਸ਼ਨ ਲਓ। ਯੂਨਿਟ 101 8035 120 ਸਟਰੀਟ ਡੈਲਟਾ, ਕਾਲ 604 596 1774।
Once again, welcome back to the program. ਅੱਜ ਦੇ ਸੈਗਮੈਂਟ ਵਿੱਚ ਅਸੀਂ ਗੱਲਬਾਤ ਕਰਾਂਗੇ ਐਲਨ ਗਲੈਸਰ ਨਾਲ, ਜਿਹੜੇ ਕਿ ਇੱਕ ਫਾਰਮਾਸਿਸਟ ਹਨ ਅਤੇ ਕਲੀਨਿਕਲ ਇੰਸਟਰਕਟਰ ਹਨ UBC ਦੇ ਵਿੱਚ। ਇਹ ਸਾਡੇ ਕੋਲ ਆ ਕੇ ਗੱਲਾਂ ਬਾਤਾਂ ਕਰਕੇ ਸਾਨੂੰ ਦੱਸਿਆ ਕਰਦੇ ਨੇ ਕਿ ਜਦੋਂ ਮੈਡੀਕੇਸ਼ਨਸ ਦੇ ਸੰਬੰਧ ਵਿੱਚ ਕੋਈ ਵੀ ਇਨਫੋਰਮੇਸ਼ਨ ਲੈਂਦੇ ਆ ਤਾਂ ਉਸ ਦੇ ਵਿੱਚ ਕਿਹੜੀ ਚੀਜ਼ਾਂ ਦਾ ਧਿਆਨ ਰੱਖਣਾ ਚਾਹੀਦਾ ਹੈ। ਅੱਜ ਦਾ ਟੌਪਿਕ ਬੜਾ ਸਿੰਪਲ ਟੌਪਿਕ ਹੈ, ਲੇਕਿਨ ਇੱਕ ਬੜਾ ਕੰਪਲੈਕਸ ਟੌਪਿਕ ਹੈਗਾ ਹੈ ਕਿ ਜਦੋਂ ਅਸੀਂ ਮੈਡੀਕੇਸ਼ਨਸ ਲੈਣੀਆਂ ਹੈ, what should be kept in mind? ਕਿਉਂਕਿ ਆਮ ਤੌਰ ਤੇ ਅਸੀਂ ਇਹ ਸਮਝਦੇ ਹਾਂ ਕਿ ਡਾਕਟਰ ਨੇ ਸਾਨੂੰ ਲਿਖ ਕੇ ਦਿੱਤਾ ਬਿਫੋਰ ਔਰ ਆਫਟਰ ਲੰਚ ਜਾਂ ਡਿਨਰ ਅਸੀਂ ਤੁਸੀਂ ਆਪਣੀ ਮੈਡੀਸਨ ਲੈ ਲਓ, ਪਰ ਉਸ ਦੇ ਨਾਲ ਕਿਹੜੀ ਚੀਜ਼ਾਂ ਦਾ ਧਿਆਨ ਰੱਖਣਾ ਚਾਹੀਦਾ ਹੈ, ਆਓ ਇਸੇ ਸੰਬੰਧ ਵਿੱਚ ਗੱਲਬਾਤ ਕਰਦੇ ਹਾਂ ਐਲਨ ਗਲੈਸਰ ਨਾਲ। Welcome to the program.
Thank you, Harpreet.
Thank you once again. So Alan, I was just telling my viewers that by now I think you must be understanding a little bit of Punjabi now. So what I was telling them was that basically we think that when we get a prescription for a medicine, the doctor writes before lunch or after dinner, we just take it and that's it. But it's a little bit more to that. When you are to have any medicine, some things should be kept in mind. So what are the common mistakes which you as a pharmacist and your experience tell, which people make and that can be dangerous for them?
That's right. Well, the most common mistake is when you take your pill or tablet or capsule, people forget they should be drinking a glass of water,
Okay.
the size of a cup, that's 6 to 8 ounces, and drink that whole glass of water.
Okay.
I know many of my clients tell me, oh, they're too busy, they're in a busy life, they can just take a sip and that's enough.
Right.
Well, it's not enough. There's this tube that goes from your throat down into your stomach.
Right.
It's right there. This tube is actually not a straight steel pipe.
Okay.
It's actually got ridges in it.
Okay.
Because it's a muscle, and the tube is a muscle. It goes down, squeezes things down.
Right.
And the muscles then, when it goes the other way,
It goes up.
it goes up.
Right.
But it's a muscle, and it actually has ridges.
Okay.
Little ridges. And when you take an aspirin tablet or a Tylenol tablet,
Right.
and you people call it dry swallow, you just swallow it down, it actually is stuck in this tube. That tablet will do nothing for you for hours sometimes, because it's stuck in this tube and the muscles can't feel enough of that lightweight tablet
Okay.
to squeeze it down into
Right.
your stomach. That's the number one reason why medicines such as for pain control.
Right.
So it's your Tylenol, your Advils, your Aleve of the world, the Celebrexes, naproxens.
Right.
They don't work right away because they're actually stuck in this tube.
Oh.
When you don't drink
Enough
at
water.
least this much water.
Right.
Okay? When you drink that, it number one prevents heartburn, because
Okay.
many people say, oh, when I take these things, I have a stomach ache.
Right.
Number one reason you got a stomach ache, you didn't have enough water in it to dissolve it.
Okay.
So it irritated your stomach. So you can stop that problem just by drinking
Right.
a good 6 to 8 ounce glass of water.
Okay. Tell us a little bit about absorption of medicine. Like, how does the medicine get absorbed? And like you said, you put it in your mouth. These muscles, extract it and just pulls it down. But until unless there's a continuous flow of water, it might get stuck.
Okay.
So when it goes into the stomach, what happens?
Okay. The only thing that gets absorbed from our stomach is alcohol.
Okay.
That's why you can feel it quicker than anything else.
Right.
Okay, so you got the stomach here.
Right.
It's the first part of digestion.
Right.
So it's sitting right below your chest. People kind of know where it is.
Right.
Not until that stomach empties out into the next part. We have a long intestine. Basically, it's a long, giant muscular tube.
Right.
That goes from the small intestine to a large intestine, in and out. Now, you only get drug absorption after the stomach has emptied. So in order to make sure your stomach empties out, because the first solution, so it goes into solution, the pill or capsule in your stomach starts digestion, but nothing is absorbed. That's why it takes at least 20 minutes to half an hour
Okay.
for any medicine to start working.
Right.
Especially you have pain medicine,
Right.
right? That's why there are some drugs now that you dissolve under your tongue. It goes right into your bloodstream,
Right.
and it starts working much quicker.
Okay.
but most of us like to take a pill or a capsule. So that's why at least 20 minutes to go in the stomach and empty out. If you take your medicine after you eat, guess what's going to happen? There's a delay factor
Right.
because your stomach's full of food.
Okay.
It's going to take time to empty, maybe an hour or two.
Right.
And then the medicine that you took after your food is going to be slow to work,
Okay.
right? Especially if it's a pain medicine.
Right.
So unless otherwise told, there's certain drugs you need to take, say, after food or milk,
Right.
or just after milk, depends if you take milk, that will delay the your stomach's full of food,
Right.
it gets delayed, it's not going to work, especially a pain medicine. The best thing, again, 6
Have
to 8
more
ounces
water.
of water and drink that. That'll dilute things and help the stomach empty quicker.
Got it, got it. So
Okay.
water is essential to get that.
Yes.
But now what I'm hearing is and seeing also many times on the medicines, it's written fast absorption, and like for example, some painkillers, they're in the form of, one is a pill and the other is in the form of a gel kind of thing. So is there any difference, or it's just a new thing coming into the market?
I think it's just a new thing coming on the market. They say there's a slight difference. They all have to, when you swallow it,
Right.
they all have to go in the stomach. The gel cap might dissolve a little quicker
Right.
than a capsule, but they all have to go in the stomach and then be emptied out.
Okay.
It still takes about 20 minutes. You
Right.
might shave just a few minutes off.
So first thing, as you said, is taking plenty of water. What
Yes.
other mistakes do people make while having medicines?
Okay, so there are some medicines, especially some antibiotics like amoxicillin or cephalexin. These are common antibiotics you get.
Right.
It says take 3 times a day because it's actually 3 times a day means 3 times in 24 hours.
Okay.
That means 1 tablet every 8 hours. And there's a simple reason for it. The first reason is at 0, this is hours down here.
Right.
Okay, at 0, there's nothing in your stomach, nothing in the blood. We're checking drug in the blood.
Right.
So it takes a few minutes to reach a peak
Okay.
and then go away.
Right.
So when you take your medication every 8 hours, we're kind of ensuring that we get an even level
Okay.
of drug in the blood.
Right.
That you take it about 8 hours and then it goes back up again. If you delay taking your medicine, that means you have no antibiotic in your system helping kill the infection.
Okay.
So it can get worse. If you take it too soon, right? If you take it every 6 hours or something like that, or every 4 hours, you already got lots of drug in your blood. You're going to put more than you need in, and it could make you feel sick.
Okay.
Okay, so 2 reasons why, if it says 3 times a day, take it by the clock
Right.
every 8 hours,
Okay.
right? To help prevent any problems.
Right.
Now, the other thing that people do, they decide if 1 is good, 2 is better. That's not true.
Right.
In some drugs, because here's another picture, very quickly.
Right.
This is the concentrate, the amount of drug you need to get
Okay.
an effect.
Right.
Okay, as you can see, when we keep increasing the drug, all of a sudden we get to one particular point where just a little bit of drug makes a
Right.
huge difference. We almost get 100% effectiveness
Okay.
at a particular amount of drug.
Right.
Now, if you're there and you double it, you don't get any more effect,
Right.
but it could make you sick. That's what the problem is. So
Right.
the dose on there is made so that you are in this range. It's a very narrow drug range where you will get 100% effectiveness.
Right.
So avoid doubling up unless it says you're allowed to do so.
Okay.
So if it only says 1 at a time, do not avoid 2
Right.
because it can make you sicker.
Another
Yes.
thing, what we find is when we talk about antibiotics, and especially we take them, but if we start feeling well, we stop using that. I'd like to have your views after this break about this particular issue, because many times we get prescriptions for 7 days or 10 days. After the 3rd or 4th day, if you are feeling well, we just stop it. Is it right? Is it not good? We'll get your perspective on this after this short break. Thank you.
Thank you.
ਸੋ ਹੁਣ ਤੱਕ ਜੋ ਅਸੀਂ ਗੱਲਬਾਤ ਕੀਤੀ, ਐਲਨ ਨੇ ਦੱਸਿਆ ਕਿ ਮੈਡੀਕੇਸ਼ਨਸ ਦੇ ਸੰਬੰਧ ਵਿੱਚ ਇਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਜਦੋਂ ਵੀ ਮੈਡੀਸਿਨ ਲੈਣੀ ਹੈ ਤਾਂ ਆਮ ਤੌਰ ਤੇ ਜਿਹੜੀ ਅਸੀਂ ਮਿਸਟੇਕ ਕਰਨੇ ਆ ਕਿ ਅਸੀਂ ਪਾਣੀ ਬਹੁਤ ਘੱਟ ਪੀਂਦੇ ਆ, ਥੋੜੇ ਜਿਹੇ ਪਾਣੀ ਨਾਲ ਅਸੀਂ ਗਲੇ 'ਚ ਲੰਘਾ ਜਾਂਦੇ ਆ ਗੋਲੀ ਨੂੰ, ਪਰ ਇਹਨਾਂ ਦਾ ਕਹਿਣਾ ਕਿ ਕਈ ਵਾਰੀ ਉਹ ਅੜ ਸਕਦੀ ਹੈ ਤੁਹਾਡੇ ਅੰਦਰ ਜਾ ਕੇ, ਤੇ ਇਸ ਕਰਕੇ ਪਾਣੀ ਐਟਲੀਸਟ ਜਿੰਨਾ ਇਹ ਗਲਾਸ ਹੈਗਾ ਇਹ ਜ਼ਰੂਰ ਪੀਆ ਜਾਏ। ਦੂਸਰੇ ਪਾਸੇ ਇਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਕਈ ਵਾਰੀ ਅਸੀਂ ਇਹ ਕਰਦੇ ਹਾਂ ਕਿ ਜਿਹੜਾ ਸਮਾਂ ਹੁੰਦਾ ਹੈਗਾ ਦਵਾਈ ਦਾ, ਜੇ 3 ਵਾਰੀ ਤੁਹਾਨੂੰ ਪ੍ਰਸਕ੍ਰਾਈਬ ਕੀਤੀ ਗਈ ਹੈ ਤਾਂ ਕਈ ਵਾਰੀ ਅਸੀਂ 2 ਵਾਰੀ ਲੈ ਲੈਂਦੇ ਹਾਂ ਜਾਂ ਟਾਈਮ ਸਿਰ ਨਹੀਂ ਲੈਂਦੇ। ਇਸ ਕਰਕੇ ਇਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਇਹ ਚੀਜ਼ ਦਾ ਜ਼ਰੂਰ ਧਿਆਨ ਦਿੱਤਾ ਜਾਵੇ ਕਿ ਇੰਟਰਵਲਸ ਜਿਹੜੇ ਨੇ 8-8 ਘੰਟੇ ਦੇ ਰੱਖੇ ਜਾਣ ਜੇ 3 ਵਾਰੀ ਲੈ ਰਹੇ ਹੋ, ਤੇ ਨਾਲ ਇਹ ਵੀ ਨਹੀਂ ਕਰਨਾ ਕਿ ਜੇ ਮਿਸ ਹੋ ਗਈ ਤਾਂ ਚਲੋ 2 ਇਕੱਠੀਆਂ ਹੀ ਖਾ ਲਾ। ਇਹ ਚੀਜ਼ਾਂ ਦਾ ਜ਼ਰੂਰ ਧਿਆਨ ਰੱਖੋ। ਫਾਈਨਲੀ ਐਂਟੀਬਾਇਓਟਿਕਸ ਦੇ ਸੰਬੰਧ ਵਿੱਚ ਕੀ ਇਹਨਾਂ ਦੇ ਵਿਚਾਰ ਨੇ, ਇਸ ਬ੍ਰੇਕ ਤੋਂ ਬਾਅਦ ਜਾਣਕਾਰੀ ਲੈਣੇ।
ਕੀ ਤੁਸੀਂ ਕਿਸੇ ਵੀ ਕਿਸਮ ਦੀ ਦਰਦ ਤੋਂ ਪਰੇਸ਼ਾਨ ਰਹਿੰਦੇ ਹੋ? ਹੁਣ ਫਿਕਰ ਦੀ ਲੋੜ ਨਹੀਂ, ਕਿਉਂਕਿ ਸਿਰਫ 90 ਸਕਿੰਟਾਂ ਵਿੱਚ ਤੁਸੀਂ ਦਰਦ ਤੋਂ ਰਾਹਤ ਪਾ ਸਕਦੇ ਹੋ। ਮਾਰਕਸ ਫਾਰਮੇਸੀ ਦੇ ਐਲਨ ਗਲਾਸਰ, ਜੋ CKNW ਤੇ ਸ਼ਨੀਵਾਰ 6 ਵਜੇ ਸਿਹਤ ਸੰਬੰਧੀ ਪ੍ਰੋਗਰਾਮ ਕਰਦੇ ਹਨ, ਨੂੰ ਆ ਕੇ ਮਿਲੋ ਤੇ ਆਪ ਪੁੱਛੋ ਕਿਵੇਂ ਦਰਦ ਖਤਮ ਹੋ ਸਕਦੀ ਹੈ। ਇਸ ਐਡ ਦਾ ਹਵਾਲਾ ਦਿਓ ਤੇ ਮੁਫਤ ਕੰਸਲਟੇਸ਼ਨ ਲਓ। ਯੂਨਿਟ 101 8035 120 ਸਟਰੀਟ ਡੈਲਟਾ, ਕਾਲ 604 596 1774।
ਸੋ ਇੱਕ ਵਾਰ ਫਿਰ ਸਵਾਗਤ ਕਰਦੇ ਹਾਂ ਜੀ। ਤੇ ਗੱਲਬਾਤ ਚੱਲ ਰਹੀ ਹੈ ਐਲਨ ਗਲਾਸਰ ਨਾਲ, ਜਿਹੜੇ ਕਿ ਇੱਕ ਫਾਰਮਾਸਿਸਟ ਅਤੇ ਕਲੀਨਿਕਲ ਇੰਸਟ੍ਰਕਟਰ ਨੇ UBC ਦੇ ਵਿੱਚ। ਇਹ ਸਾਨੂੰ ਦੱਸ ਰਹੇ ਨੇ ਕਿ ਜਦੋਂ ਦਵਾਈ ਲੈਣੀ ਹੈ ਕਿਹੜੀ ਚੀਜ਼ਾਂ ਦਾ ਧਿਆਨ ਰੱਖਿਆ ਜਾਏ, ਕਿਹੜੀ ਆਮ ਤੌਰ ਤੇ ਲੋਕਾਂ ਗਲਤੀ ਕਰਦੇ ਨੇ। ਇਸੇ ਸੰਬੰਧ ਵਿੱਚ ਆਓ ਜਾਣਕਾਰੀ ਲੈਣੇ ਕਿ ਐਂਟੀਬਾਇਓਟਿਕਸ ਦੇ ਸੰਬੰਧ ਵਿੱਚ ਕਿਹੜੀ ਚੀਜ਼ਾਂ ਦਾ ਧਿਆਨ ਰੱਖਣਾ ਚਾਹੀਦਾ ਹੈ। ਸੋ ਐਸ ਫਾਰ ਐਜ਼ ਐਂਟੀਬਾਇਓਟਿਕਸ ਆਰ ਕੰਸਰਨਡ, what should be kept in mind when you are having those?
So, antibiotics, usually on the label, they'll say take it once a day, twice a day, 3 times a day, some even 4 times a day.
Right.
That means to you that if it's once a day, that's once every 24 hours. Take it always at the same time.
Right.
Twice a day, that means once every 12 hours. Okay? 3 times a day, once every 8 hours and 24, and 4 times a day, ideally, once every 6 hours. Now, I know that's very difficult. That's most of our newer medications, the most you need to take it is once, 2 or 3 times a day.
Right.
Because the key thing is if you stop after you start to feel good, because you will feel good if the antibiotic's working in 2 days, that's 4 to 8 hours to know the antibiotic working.
Right.
But what happens is that the bug, the bacteria is still in our body. The antibiotic has helped our body destroy a lot of it, so you feel better.
Okay.
But it's still there.
Right.
When you stop the antibiotic, you give those bugs a chance to come back.
Okay.
And now they'll be resistant. They may not respond
Right.
to the same antibiotic you just finished.
Okay.
That's the biggest danger. That's what's happened in our hospitals where they have bacteria
Right.
that are incurable with our antibiotics. That's pretty scary. You only get that mostly in hospitals, but
Right.
it's an issue that's growing, and the research being done, there might be hope for us, but right now we're coming to a point where we're stuck.
So what you're saying is, in spite of you feeling good, but complete the medication,
Yes.
whether it was 7 days or 10 days, whatever it is.
Yes.
Right. Another thing what we find is, as far as blood pressure tablets are concerned, what happens if we take it, wrong?
So, there are some blood pressure medications that if you stop them
Right.
Unknowingly, they will, and it's written in the information sheet you may get,
Right.
it may spike your blood pressure higher so that you have maintained a good low blood pressure.
Right.
But if you skip a day and you forget, some of the medication, your body does a rebound high blood pressure. I mean, it can be at low or average, and then it spikes higher. When that spikes higher, you are at risk for stroke, heart attack, or kidney failure.
Okay.
So that's pretty scary that you can have that severe. So it's once you start these things, do take them all the time and never run out. And I will tell you that every pharmacist can give you extra if you need it in BC. If you've
Right.
run out, can't see your doctor, we can certainly help you.
Okay, thank you for this information. And finally, when we talk about birth control pills, many of the ladies take this. So what happens if here you do take more or less?
Okay, so if you forget one day of birth control pills, mostly you can take 2 the next day and you're okay.
Okay.
But if you forget more than one day of birth control pills, that means they probably won't work and you need another method of birth control.
Okay.
That's what the problem is.
Thank you for this information. Thank you.
You're welcome.
ਅੱਜ ਜੋ ਅਸੀਂ ਗੱਲਬਾਤ ਕੀਤੀ ਐਲਨ ਗਲੈਸਰ ਨੇ, ਜੋ ਬਾਅਦ ਵਿੱਚ ਦੱਸਿਆ ਗਿਆ ਬ੍ਰੇਕ ਤੋਂ ਬਾਅਦ, ਕਿ ਜਿਹੜੇ ਐਂਟੀਬਾਇਓਟਿਕਸ ਅਸੀਂ ਲੈਂਦੇ ਹੈਗੇ ਆ, ਇਹ ਪੂਰੇ ਦਾ ਪੂਰਾ ਕੋਰਸ ਲੈਣਾ ਚਾਹੀਦਾ, ਵਿੱਚ ਹੀ ਨਹੀਂ ਛੱਡ ਦੇਣਾ ਚਾਹੀਦਾ। ਆਮ ਤੌਰ ਤੇ ਅਸੀਂ ਇਹੀ ਦੇਖਦੇ ਹਾਂ ਕਿ ਗਲਾ ਖਰਾਬ ਹੋਇਆ ਹੈ, ਐਂਟੀਬਾਇਓਟਿਕਸ ਮਿਲੇ, ਅਸੀਂ 2-3 ਦਿਨ ਖਾਧਾ, ਲੱਗਦਾ ਠੀਕ ਹੋ ਗਿਆ, ਅਸੀਂ ਵਿੱਚੋਂ ਛੱਡ ਦਿੰਦੇ ਹੈਗੇ ਆ। ਇਸ ਕਰਕੇ ਇਹ ਚੀਜ਼ ਦਾ ਧਿਆਨ ਦਿੱਤਾ ਜਾਏ। ਸੈਕੰਡਲੀ, ਬਲੱਡ ਪ੍ਰੈਸ਼ਰ ਦਾ ਜਿਹੜਾ ਇਹਨਾਂ ਨੇ ਕਿਹਾ, ਜਿਹੜੀਆਂ ਤੁਸੀਂ ਪਿਲਸ ਲੈਂਦੇ ਹੋ, ਉਹਦੇ ਵਿੱਚ ਵੀ ਧਿਆਨ ਦੇਣ ਦੀ ਲੋੜ ਹੈਗੀ ਹੈ, ਕਿਉਂਕਿ ਜੇਕਰ ਉਹ ਸਮੇਂ ਸਿਰ ਨਹੀਂ ਲਈ ਜਾਂਦੀ ਜਾਂ ਡਬਲ ਲੈ ਲਈ ਜਾਂਦੀ, ਉਹਦੇ ਨਾਲ ਵੀ ਨੁਕਸਾਨ ਹੋ ਸਕਦਾ ਹੈ। ਐਂਡ ਫਾਈਨਲੀ, ਬਰਥ ਕੰਟਰੋਲ ਪਿਲਸ ਦੇ ਬਾਰੇ ਨੇ ਕਿਹਾ ਕਿ ਜੇਕਰ ਇੱਕ ਔਰਤ ਇੱਕ ਦਿਨ ਭੁੱਲ ਜਾਂਦੀ ਹੈ ਤਾਂ ਅਗਲੇ ਦਿਨ 2 ਲੈ ਸਕਦੇ ਨੇ, ਪਰ ਇਹ ਰੈਗੂਲਰ ਅਫੇਅਰ ਨਹੀਂ ਬਣਨਾ ਚਾਹੀਦਾ।